Hello, ladies and gentlemen. We're so happy that you're here. Welcome to an incredible presentation all about midlife and metabolism and hormones. And today we have an incredible panelist group that's going to be sharing a little bit about their journeys. I'm Dr. Sky Davis, board certified naturopath, nutritionist, and owner of Sky Life Naturopathic Health Clinic in Lake Geneva, Wisconsin. I've been a licensed provider for 18 years. And I have got to a point where I wanted to really handle the concerns that were walking through the door, which is women and men struggling in midlife. So LEMD came through with their incredible peptide products, and I wanted to share how those products have been transforming lives and giving men and women the hope that they've lost in midlife, and also the importance of getting peptides from safe sources. So without further ado, sit back, relax, and we're going to be putting on an incredible presentation. I'd like to introduce our panelists for today.
Hello, everybody. My name is Zainab Nasser. Thank you so much for joining us. And I'm a registered nurse and functional diagnostic nutrition practitioner.
Hi, everybody. Mary Catalona here, a functional diagnostic nutrition practitioner, endurance athlete, and, corporate mom.
All right, awesome. I'm Lori Werner, everybody. So thank you so much for joining. I am an entrepreneur, so I actually have been working in the functional medicine space for almost 10 years now. I actually work with hundreds of functional and naturopathic physicians across the United States in my business as a marketing agency. And then also, just fun fact, I am a menopausal woman, so I am very much the patient as well. And so I'm really excited to be part of the webinar and share a little bit about my journey with peptides. And I'm really excited to hear what Dr. Sky is going to teach all of our friends here. So thank you.
Thank you. In today's presentation, we're going to be discussing midlife for men and women and some of the things that we're going to be expecting or experiencing already. An overview of peptides for weight loss, longevity, joint health, gut health, and sexual health. And we're going to discuss the safety, purity, and potency of LEMD peptides to see if it's a good fit for you. Well, the fact is that women spend over half of their lifetime in perimenopause and menopause. So it's such an important topic. It often brings a period of hopelessness, low mood, hormonal shifts, joint stiffness, sleepless nights, low energy, sexual dysfunction, and so much more. So we really want to bring to light this important time in our lives so that we can help men and women to regain their health, regain their hope, and really step into this next chapter of their life in the best health possible. Some of the other important things that menopausal women will and can experience is body fat that accumulates, especially around the midsection and hips. Lean muscle mass can decline, and they could just feel sleep deprived. And then we also deal with the health risks of all of that weight gain in midlife. We're looking at heart and metabolic diseases, cancer, joint problems, mental and cognitive decline. And it's not just for the women, men as well go through what we consider menopause, where their weight will increase around the belly and also increase the risk of heart disease. Let's talk a little bit about weight loss as it relates to LEMD and the products that we carry. LEMD really shines in weight loss with the GLP-1s. GLP-1s are glucagon-like peptides that are naturally occurring hormones in our bodies currently and play an important role in regulating blood sugar levels, appetite, digestion, which lowers blood sugar and reduces appetite. This is an important clinical weight loss study where they've studied 2,000 people, and you can see that the group that took the GLP-1s lost 15 to 20% of their total body weight, while the group that did not take GLP-1s only lost 2.5%. So while fitness, nutrition, and lifestyle are important, so many men and women experience sluggish weight loss with these traditional methods, whereas while adding GLP-1, much better results. Some other proven health benefits is going to be reduction in heart disease, lowering blood pressure, reduction in inflammation, improved heart function, lowered risk of arrhythmias. And there's also incredible cognitive benefits as well, in cognitive function improvement, reduction in ADD and antidepressants, improved in the blood-brain barrier, increase in neurogenesis, neuroprotection against Alzheimer's disease, increase in brain-derived neurotrophic factor, and protein that repairs the brain. Thank you, GLP-1. And the FDA just released that the tirzepatide or GLP-1 GIP is now a cure for sleep apnea that does plague so many men and women today. And emerging studies are now coming out that GLP-1s are benefiting those with addictions. That would be food addictions, alcohol, drugs, gambling, all of the many addictions that we face. GLP-1 support is a new product with LEMD. Americans are protein deficient. Protein is water soluble. We must get it in every single day. It's responsible for so many different functions. Important one, of course, is our muscle health and retention. So this is an incredible product that should be really paired with any GLP-1 program. And it absolutely tastes delicious. It doesn't spike insulin, and it is plant-based. Let's talk about microdosing. A lot of men and women come to us asking for GLP-1s, but don't meet the requirement for the standard dosing. We do offer the microdose option, which is a smaller amount that can target so many other metabolic dysfunction, inflammation reduction, improved insulin sensitivity, helps with hormonal support, helps with reducing the food noise, metabolic flexibility, and it helps with sleep and energy. And with microdosing, you do not need a specific BMI. So if you have a lower BMI, you may be considered for this medication. Let's talk about some of the longevity peptides. The incredible NAD+, this is really one of my favorites because it's going to help you to regain some of that spark, that energy, cognitive function. It's like the feel good, feel back to when we could recover from staying out late, and it helps with our anti-aging benefits, also helps with sleep, cognitive function, and so much more. Vitamin B12, another important one. B12 is associated, low B12 levels are associated with neurological impairments. So anyone dealing with low mood, low energy definitely needs to consider this one. BPC 157, TB 500, this is one of the reasons I got into peptide therapies, is because so many of my patients were dealing with old injuries. And so this is a product that helps to essentially help your body to repair, regenerate, and recover from injuries or old injuries. A lot of athletes will use this to recover faster. And it also helps with overall inflammation. And it's used as well for gut ailments as well, IBS, Crohn's, etc., because we have this peptide in our gut. Samorelin injection and tablets. Samorelin is a secretagogue growth hormone. It helps the body to produce its own growth hormone. So it can help with muscle growth, sleep quality, fat metabolism, and helping us to put on that healthy, new, lean muscle. Tesamorelin, ipamorelin. This is another secretagogue to help with the production of the growth hormone. So if you do feel hesitant because of, rapid weight loss and muscle loss, this is a great one to pair with it to help the body to preserve the lean muscle and also put on new lean muscle as well. Glutathione. Glutathione is our master antioxidant. This one is an incredible liver detox. It's going to help with your skin, hair, and nails. It's going to protect against free radical damage, and it's a great one to do twice a year. Synapsin. If you're dealing with brain fog, anything to do with the mood, cognitive function, this is a really great one to supplement into your daily regimen. GHKCU, one of my favorites. Comes in it's a beautiful blue color. It's naturally derived that way. This one is going to help support your collagen, so your hair, skin, and nails, tissue repair, so many incredible benefits. Skin tightening, definitely should be paired with a great GLP-1 protocol. And this is one of my favorites, because as women get into midlife, they feel their libido and really their sexual zest for life declines. They feel like something's wrong with them. We have some incredible products that help with men and women to enhance the feeling of sexual desire, can help with lubrication, sexual arousal. And again, it's great for men and women. So this is available in an injection and a nasal spray. And let's touch on why LEMD peptides are the best. There's so many peptides on the market right now, black market, gray market. LEMD only handles products that are compounded right here in the US. We don't deal with any research grade peptides. Our products are from FDA inspected facilities and ingredient suppliers only. We have potency verification with independent lab testing. We work with 503A and 503B compounding pharmacies. And one important thing in addition to all of those is that our peptides are triple and quadruple filtered. And this is important because a lot of these peptides that are coming in from China and all over Odysseys and also in the US are not filtered. So we want to make sure that the products that you're taking are clean. And LAMD only works in small batches. So the products that are coming to you are of the highest quality. We're also NABP accredited. That's voluntary. That's the National Association of Boards of Pharmacy. To get started is very simple. All you'll need to do is scan or go to the link that you were referred to. You're going to sign up as a free customer. You're going to choose the product. You're going to add it to your basket. A HIPAA protected health assessment will pop up. You'll fill that out. That'll go straight to the telemedicine staff in your network. We do ship to all 50 states. So that your medical information is protected by HIPAA. It will go straight to the doctor that is in your network. They'll review the information, make sure that it is safe for you to take. These are medically supervised. As long as they don't see anything on your assessment that's contraindicated, you will be approved. That prescription will be emailed to you, and then it will be shipped right from the pharmacy to your front door. We do offer 24/7 support, chat support, and if needed, phone support with the doctor. That's unlimited. So if you have any concerns, side effects, which are rare, but we do have that support for you. There's no extra charge for as many appointments or as much support as you need. We will provide that for you. So it is a very simple process. 7 to 10 business days is what is expected. A lot of times you'll get it before that, which is really great. And we're going to touch on a few of our panelist testimonies.
Hello, everyone. Thank you, Dr. Sky, for all of the valuable information. Once again, my name is Zainab Nasser, and I'm a cardiac registered nurse, functional diagnostic nutrition practitioner, and founder of Integrative Health Choice. At Integrative Health Choice, I specialize in helping people find the hidden stressors and root causes to their health concerns and conditions. And one of the tools I've especially grown passionate about is peptides. I integrate peptides alongside functional testing, nutrition, and lifestyle strategies. I always follow foundations first and then add in peptides. That way, clients aren't just masking symptoms, they're actually healing and building resistance at the cellular level. Two peptides I really love and use on myself and clients are NAD plus and BPC 157. NAD plus is incredible for supporting energy production at the mitochondrial level, which means better cellular repair, brain function, and overall vitality. Some of it I know Dr. Sky had already touched on briefly. And BPC 157 is one of my reasons also for looking into the peptide world, because it's often referred to as the healing peptide. It's known for its gut repair properties, reducing inflammation, and speeding up recovery. Together, they could be powerful for clients who are looking to restore balance and optimize their health from the inside out. I use these peptides on people who suffer from leaky gut, traumatic brain injuries, fatigue, inflammatory conditions, just to name a few reasons. I have a personal story myself when it comes to health and healing, and I find that peptides can accelerate the healing process. In fact, that's something that I hear from a lot of clients and people that have tried peptides, accelerating the healing process. And again, when you apply the foundations of health, they really work well with one another. I do find that so many people are stuck in certain areas of health, and peptides can be their answer because they act as messengers in the body. It's not a steroid like many people may think. They're chemical messengers in the body telling the body what to do to heal, to repair, and to regulate itself. And finally, in brief, I find that looking ahead, I see peptides as one of the fastest growing areas in integrative medicine. And I feel that they bridge the gap between conventional and functional approaches by offering highly targeted science-backed therapies and fewer side effects than many traditional options. And I'm just excited to see what else is coming down the pipeline for this type of medicine. Thank you.
Awesome, Zainab. Mary Catalona here, again, functional diagnostic nutrition practitioner, also an endurance athlete. So I just wanted to share maybe my personal story first and how I got introduced to peptides, and then explain how I'm also going to introduce them or have introduced them to my clients. So again, endurance athlete, completed my first full Ironman last year. But that basically means that for the last 10 years, I have endured a lot of training. I'm really hard on my body, but I love it. Throughout my Ironman training, I encountered a really bad hamstring tendonitis. Basically, my hamstring tendon pulled away from my glute. It's extremely painful. It's very common in endurance athletes and runners. But post Ironman, it was extremely painful. I took 2 months off of running, tried everything from PT, hot therapy, cold therapy, dry needling, acupuncture. I mean, you name it, I tried it. Did I get some relief? Yes. Did I learn foundational tools that I have in my toolbox for physical therapy? Absolutely. But I've been listening to functional medicine doctors talk about peptides for years. And I was like, how can I get my hands on some of these? I really wanted to test them out. So what I like about what I did is I tested out on myself first. So I did the BPC 157. And just like Dr. Sky and Zainab were explaining, it really helped to accelerate my healing process. Like I said, I was doing everything. So I would say my pain level went from, even with doing all the things, like a level 8 down to a level 3 within weeks. I was just ecstatic about the results. And that's why I just could not wait to join LEMD to get this out to my clients. So that's my personal journey. I'm also doing Sermolin, which again helps with creating the lean muscle, which I think is going to be awesome for my training and my future races. Also with glutathione, incorporating that for detoxification, energy level. But moving on to my client's side, my clients basically come to me with having a great foundation. They exercise, they endure stress management activities, they eat well. They're usually coming to me because they're, type 8 personalities that are burnt out, fried out, doing all the things, and they're just looking for that next thing to support them in their wellness journey. Why? Because they are high energy people and they just love doing what they do. So I work with them on taking it to the next level, do that foundational piece when it comes to diet, rest, exercise, and stress management. But the peptides is going to help them, again, just take it to that next level. A client that I'm working with, she's endured some very stressful traumatic events over this year and is doing the GLP-1 microdosing because she has put on some weight, mainly due to stress. So I think it's just an awesome tool that we can incorporate in our toolbox to really help us through the stressful life events and take it to the next level. So I appreciate it. Thanks.
Awesome. Thank you so much, both of you guys. So I'm Lori. Again, thanks for my friends that have joined today to kind of hear my story. And so as I mentioned, I've worked in the functional medicine arena. I've surrounded myself with literally hundreds of functional medicine providers. In addition to that, I go to a lot of these medical conferences, and I've actually sat in the peptide course for physicians 2 different times. So I'm personally very comfortable with the data that is behind these sort of, and the other thing I would say is these are not pharmaceuticals. These are peptides that are, as Zainab, I think she said it perfectly, they are telling your body to do what it's supposed to do. And a lot of these signals we have lost as we age. And so from a professional standpoint, I feel very comfortable with these as a solution for myself. But kind of how I've gotten to where I'm at in terms of my journey with peptides. So I went through menopause at 41. I'm 49 now. And it was very difficult. I'm a very glass half full sort of person. I became a glass half empty sort of person. I've been pretty fit my whole life. I've always been into exercise. I eat well. I'm gluten free. I do intermittent fasting. I have a Peloton bike. I get my 10,000 steps a day. I was doing Orange Theory. And this third picture here actually is me. And this is the day that I on the left is moving my daughter into college. And that is not me. I mean, I just was like, okay, how am I doing all of these right things? And I literally cannot lose a pound. And it sort of makes you depressed. It makes it where your clothes don't fit. You hope you don't run into somebody from high school and they're like, have you seen Lori lately? And so for me, I did work with a functional medicine doctor to get my hormones balanced. So even in this picture, I had been on bioidentical hormones for a number of years, which again, I could do a whole talk on that and how life-changing it is, but it doesn't really help with weight loss. And that was the thing that was just making me feel like crap about myself, despite all my hard work. So I talked to my doctor about it and I got introduced to microdosing the GLP-1. So I have been microdosing the GLP-1 GIP, which is, in other words, tirzepatide. It's the two-pronged GLP-1 since January. I have dropped 21 pounds of body fat. I also have an in-body scale at my house, so I can measure my lean muscle mass. I have maintained my lean muscle mass. Now, part of that is also because I do still exercise, but I feel like now when I look in the mirror, my hard work in the gym, it's like my muscles are showing again. Like my clothes are fitting well again. Like people are like, hey, Lori, you look great. And I feel so much better as a result of that. And I think a lot of people think GLP-1s, are you cheating? No, you're not cheating. Like the GLP-1 was in our system before. Now we're in midlife. It's not there. We need a little bit of help just to replace it. And that's really what that's doing. In addition to that, it does help your systemic inflammation. So my joint aches, a lot of that stuff has been significantly improved. Also, I believe as sort of a bonus side effect of being on the microdosing of the GLP-1s. I do also take NAD. I am on the injection. I take it 3 times a week. It does absolutely help with mood, vitality, all of that sort of stuff. So I have used that. The BPC 157, I know Mary and Zaina both touched on this. A lot of menopausal women get frozen shoulder. I have taken the oral BPC 157 for my shoulder, and I'm probably 90% back to where I was before. So that's another thing to keep in mind. And then I have also done the glutathione. Again, a whole nother separate story, but I had mold toxicity for 9 months. And the glutathione was something that I used to detox my system and actually get that mold out of my system. So these really are amazing medications, you guys. And I thank you guys for looking into it and taking the time to be educated, because unfortunately, a lot of these traditional doctors, God love them, they do amazing work treating chronic condition, dealing with you when you're sick and things like that. But many of them are not necessarily trained in these peptides. And so I really thank Dr. Sky for taking the time out of her busy day, seeing patients, to do this with us and to give you guys a sneak peek into what these peptides are all about. And whether you are working with Mary or Zainab or myself or anybody else on our team, please reach out, because we are happy to connect you with Dr. Sky one-on-one on a call if you have additional questions. And just, again, share a little bit more about our journeys. But I want to scream from the rooftops that people need to know about this, especially in midlife. So thank you for letting me share my story.
Thank you all so much. All right, so it's very simple to get started. What you're going to want to do is go to the QR code or link from the person that referred you to this presentation, this call, take the online assessment, and that is it. You're just going to check out and wait for the approval, and you'll get your medication shipped right to your door.